You have to move it. Move the projector. Okay, so 50%? Okay.
Hey.
So it was in the right path controllable. So you have a weakness on the contralateral left lower limb. Okay? So second question. So it's easy. So what's the name of the area indicated by the red pin? Okay, so splenium. Okay, so you should have been better. Okay. Third question. The black top pin. What is the structure indicated by the black top pin? Hmm? 63. It did. Okay, so it should be better. So you see you have your parieto-occipital sulcus here. You have your cuneus here between the parieto-occipital sulcus. So you have your parieto-occipital sulcus here. You have your calcarine sulcus here. So you have your cuneus here. So what is in front of the cuneus? Your calcaneus. Okay? So again, it should have been better. Okay, so. Everybody can see where the pin, the green pin is? Yeah? Okay. Okay, so next one. Okay, so it was a C. Okay? So it's your lingual gyrus, which is between your calcarine sulcus and your collateral sulcus. And your lingual gyrus, its function is more or less to recognize the letters among all the functions. It has a role also in dreaming and finally for this one might be a bit more difficult. So everybody can see the white pin? Okay? Okay, so next one. So what is the thalamic nucleus having a relationship with the structure shown by the white pin? Okay, so this is the middle. Okay, so what is this structure? It's your cingulate gyrus. Okay, if you cut, so here you have your cingulate gyrus.
We can see.
Yeah. So you have your cingulate gyrus here. Fine. Right above your corpus callosum. Right. So if you cut at this level, and if you turn around, what do you have? You have your corpus callosum here, and just above the corpus callosum, you have your cingulate gyrus. Fine. Okay. And so your cingulate gyrus is part of your limbic system, and it will project on your anterior nucleus of the thalamus. Yeah. But we will see. You will see it next week. Okay? So just to show you where the cingulate gyrus can be. Enough? No, I think so.
I'm not quite certain if this section belongs to me. Thank Otwin, me, Mr. Gardner. Okay, let's have the other question then. Okay, so the question is that a blue skull at the right marker resulted in a fracture of the bone and an intracranial bleed. In which of the following areas would you expect blood to accumulate? And it's intracerebral, intraventricular, subarachnoid, extradural, and subdural. Very good, very good. Could be better than that, sure. Much better than that. Okay, what structure? This is just from my lecture, from introduction. What structure would you find in the foramen of the red marker. And we have pharyngeal nerve, greater petrosal nerves, nasopalatine, nerve of video, and lesser petrosal nerve. Everybody can see it quite well? Okay, that's much better. Right. Yeah. Okay, so it should be better still because you've done pharynx already and GIT, so you should know what's coming out of that foramen. That's the pharyngeal nerve coming from the thoracopalatine ganglia, supplying the pharynx.
A lot of vagina.
Okay, can you see that little groove there? There are two grooves at the mastoid. There's a big one just medially and another one medial to that. So what structure occupies the groove at the red marker? And the choices are posterior auricular artery, posterior belly of digastric, occipital artery, ascending pharyngeal artery, and a mastoid emissary vein. Remember that the medial to the mastoid process, you have the mastoid incisura that has the posterior belly digastric, and medial to that is the groove for the occipital artery. What we're looking at there is between the carotid canal and the jugular foramen. So there's, right? So what I'm asking you, the red pin is in a small foramen, which you can see, I think you can see quite well there. Which cranial nerve gives a branch that ascends in this foramen? It's a little bit early for this other question, but we mentioned it, and Mr. Gardner mentioned it also in the introduction.
It's not adding to your GPA when you feel like my self-esteem.
Okay, and you know, what the much better that. Remember the auricular branch of the glossopharyngeal nerve ascends there. It becomes sensory to the middle ear, and it also gives off the lesser petrosal. And everybody remembers the path of the lesser petrosal. Comes through the petrous temporal bone, goes to the foramen ovale, descends in the foramen ovale, and then it goes to the otic ganglion, All right, okay, and I wouldn't go to actually give away I've given away the next question already. Okay. All right, the next question now is related to that same red pin. Which of the following glands of the nerve of the red pin convey secretomotor parasympathetic fibers to? I expect 100% of this. You've been prompted already.
Don't put the response in there. The people still clicking it.
Very good, very good.
Probably wireless.
Okay, let's move on to section 3. Alright, so yes, so actually can we start with that? Zoom in on this. Okay, students, so press on. Very good. So that's where we would get a what sort of hematoma?
Epidural.
Epidural. Reasonable. Okay, next one. On the red pin. Okay, so the mesociliary, right? The mesociliary is going to give off branches known as the anterior and the posterior ethmoidal. So anterior and posterior ethmoidal are branches of the mesociliary nerve, right? So the mesociliary is very important, okay? For the, remember it's an ophthalmic division of the trigeminal. Okay, next slide, or next one. So that proboscis is going through sinus, right? An emissary vein will pass through there, all right? And just remember that the sinuses within have a negative pressure. So the flow of blood is from the emissary veins on the scalp to become what? Intracranial. Okay? But they're asking now, where does it flow to directly? All right. Remember, negative pressure inside. So we can pull the blood in. Alright, and it will go today. So I congratulate you at least half the class. So it goes into this. So I say condylar emissary vein. So the largest emissary foramen is a condylar emissary foramen. The largest emissary vein is the what? Condylar emissary vein when present, not always present. And it will draw blood into the sigmoid sinus. Next one. Come back a little. Actually, come off a bit. Yeah, that's okay. Oh! Okay, it's gone. Come on. Another one. Yes. Alright, so this one is asking of the neural structure that passes through the foramen. So that neural structure is very, very important. Okay? Very important, serves 301 different functions. Many, many functions. Okay, so that is it. Carotid sympathetic plexus. When we look at this answer, the response, we see that more than half the class got it wrong, which is not a good story. Reasonable, more than half the class got it wrong. And remember, when we're doing respiratory system, right, we have to talk about the innervation to the nasal cavity, etc. So we've looked at this again and again along the way. So remember, the internal carotid artery carries with it the carotid sympathetic plexus. And that carotid sympathetic plexus is going to be important for what function? Vasomotor to what? The vessels. So the blood flow within the brain is regulated in part through the carotid sympathetic plexus. And then this will now be the sympathetic innervation to something we're going to do a little later, to the eyeball. Right? Parasympathetics are going to do what? Are going to constrict the pupil, and the sympathetics will what? Dilate. Alright, together with 101 other functions. So carotid sympathetic plexus, very important. Just one quick question. Where are the cell bodies for the carotid sympathetic plexus? Where are the cell bodies for the carotid sympathetic plexus? And they are in the superior cervical ganglia. Very good. And a bit in the middle. Next question, last one, I think. Yeah, last one. Okay. All right. Okay, this is okay, the gyrus. Perfect. Okay?
Focus. Jano.
Alright, so remember, what did Betty say a while ago? Betty remembers my words. What did you say a while ago, Betty? The dog tail. Right? So remember, some of these dogs, you cut their tails and it has just goes up like that. Reasonable? So the lateral sulcus or the Sylvian fissure just makes a dog tail into the land of what? Makes a dog tail into the land of what? The inferior parietal lobule, right? And that's the supramarginal. And just a little posterior and slightly behind what Jairus got with it, angular. And Professor Louboutin was telling you about syndromes associated with the lesions to that area. So you could have asked what is a lesion associated with this area, okay? And remember, this one is more so for the interpretation of the spoken word, and it is very much in the land of who? Wernicke. Thank you very much. JP, you want to give a closing statement? But I'd like to give a closing statement. What's the closing statement? Not a good story. Right? Not a good story. Because I think this is not a good story. So we have to remember, what did we say with the neuroanatomy? It's unlike all the other things that in gut, there is stomach, pancreas, ischiorectal fossa, and all of them are different things. Neuro is a train that is just going along a track. And then we have to keep up with the reading. There can be no falling behind, must keep up with the reading. Right? It's a beautiful course, and you can get an A in it, or some nice A pluses. So push it hard.
I'm sit over here.